You need to build a multi-stakeholder movement that includes health practitioners, civil society activists, legal experts, intellectual property experts, and that doesn't exclude policymakers themselves as agents of change. This advocacy does work. The AIDS and Rights Alliance for Southern Africa is a regional partnership. ARASA was established in 2002. This was at the time when there was this recognition for the need for a rights-based approach to the HIV response in the region. The initial mandate was very much a rights-based approach to HIV and then to TB, and it has grown since then. The work that we have been doing at SADC, at the Parliamentary Forum and with the Secretariat, we think it's important because it really helps with regional integration. If we're having these conversations not just at individual country level, but we're actually then having them at the regional platforms themselves, it means that it's possible to actually have a regional strategy, and it's possible to actually have some kind of regional integration and approach. And it also then enables at regional level for us to start thinking about regional solutions. ARASA has two strategies of, first of all, it's strengthening civil society to advocate with decision makers for policy change. The work that ARASA does in terms of strengthening of civil society capacity is we have the training and leadership program in the region, which is, an annual program that admits activists, at least 2 activists per country from the 18 countries that ARASA works in. So the work of ARASA has really tried to build capacity of lawyers, particularly young lawyers, to understand intellectual property and access to medicines. And ARASA has run a few courses specifically with lawyers who are working on health rights to unpack the issues of intellectual property and access to medicines. ARASA historically been known, for access to medicines as far as HIV, Hep C, but now really used the challenges that we're having with COVID-19 as a catalyst to talk to particularly policymakers at the SADC region on why we need the change, and change needs to happen now. The lessons that we really can learn for this moment, it's exactly that civil society organizations need to understand the basics of how intellectual property affects access to medicines. We really need to work at a multi-sectorial level. So we need to work with the medical experts, we need to work with the legal experts, and we need to work not just at national level, but also at regional level. We really much continue to value spaces for horizontal learning and learning across regions by activists, particularly within and from the Global South. We've seen the changes in HIV. We've seen how prices actually did come down over a decade or so in this region from the activism that was being done by the broader movement. And clearly that's a lesson that even now with advocacy around, for example, COVID vaccinations, that, those lessons can be applied and can result in the same successes that we're looking for now.